Elementary School Teachers Need to Know About COVID-19 by Jenna Gold, Claudia, Grace Roloff, and Julia Zellmer.
Teaching during the pandemic. This has been a hectic time for many people. However, I'm sure you, elementary school teachers, have needed to almost completely change your way of doing things for online school so that your students can keep learning. For some of you, there is stress in teaching kids, both in person and online, every day. Compared to high school and college level teachers, your students are often not as proficient at using technology, the basis for online learning. This is a struggle for kids as well as creates stress for parents who are often roped into helping their children on top of work.
Being online also makes it difficult to form connections with students. Masks are a major barrier in people's ability to form connections. Younger kids cannot see your lips when sounding out words and learning to mimic your movements. Lastly, social distancing is more difficult to enforce due to younger kids who are often not thinking about personal space. COVID-19 is easily spread, so having these kids speaking so close to one another introduces more problems with in-person teaching.
In this presentation, we'll be covering what you as teachers can do to help create a healthy and safe learning environment for your students, tips and tricks for a cleaner classroom, along with an included checklist. You will also be able to identify the difference between the flu and cold symptoms and COVID-19 symptoms, which is very important as we begin to shift into these winter months. Additionally, you will learn about potential, more non-invasive testing techniques for younger children and the importance of getting tested. Also, you will have a better grasp of how contact tracing works and who it affects. Lastly, you will have possible access to COVID-19 dashboards in the area, and you will learn from case studies that were performed in other school districts regarding COVID-19.
Tips for a cleaner classroom. One of the main ways teachers can help prevent the spread of COVID in the classroom is keeping the classroom sanitized. Because children are often hands-on learners and don't fully understand hygiene yet, communal spaces in classrooms like tables become a breeding ground for germs. Some of you have designated cleanup jobs for their students to keep the classroom sanitized, as well as teaching them to do their part in keeping their fellow classmates safe. Mantras are also a great way to inform students on the importance of cleaning and keeping them motivated. Here is an everyday checklist for a clean classroom. Okay, it touches on wiping down community spaces as well as distributing hand sanitizer to students. Lastly, students should wear masks in the classroom and go home if they feel sick. And then here is an example of a weekly checklist to refer back to. This touches on disinfecting play areas as well as electronics and floors where students often sit and socialize on. Lastly, this reminds you to dispose and wash of cleaning towels in a timely manner.
So, the difference between COVID-19 and the flu. Some unique COVID symptoms include loss of taste, loss of smell, severe trouble breathing, and they're contagious for a longer period of time, which is around 2 weeks. Some unique flu symptoms are that the flu is often developed much faster than those of COVID-19, the symptoms do. It is also contagious for a shorter period of time, only around 1 week. However, symptoms of COVID-19 and the flu that are similar are fever or chills, cough, shortness of breath, fatigue, sore throat, a runny or stuffy nose, body aches, and headache. Also, both viruses are spread mainly by particle droplets. It is very important for teachers to differentiate between COVID-19 and the flu, especially as we begin to enter these winter months.
It's also critical to consider what testing methods are possible in a school setting. In order to help prevent the spread of the virus, in our course, we heard from Professor Yandel, who works here at UW-Madison. He created a simulation which showed us that increased testing could eventually make way for less undetected cases, because positive cases can be identified and those individuals can then be isolated. To gain insight on COVID-19 testing, we interviewed Dr. Shelby O'Connor, who works here at UW-Madison. She's working to implement COVID-19 testing in K-12 schools. By passing this information on to you, we hope you can help keep yourselves and your students safer in the classroom. If a student seems symptomatic, it would be critical for you to know where they can seek immediate testing. We also find it important for you to understand the complicated nature of testing for the virus.
We Also interviewed Ivy First, who teaches special ed students in all grades at Thoreau Elementary School. In order to hear her perspective on testing as an elementary school teacher, one wish she has is that testing was more widely available and that a standard testing was required for staff and students alike. At school, there has to be a level of trust between the students and faculty, ensuring that social circles remain small. Though Miss Ivy states that these small circles are actually much bigger than we perceive, hence why a standard testing should be required. She also expressed the necessity for teachers and parents alike to be notified of set transmission rates among schools and areas of work to better ensure the health and safety of faculty and families.
When we interviewed Dr. O'Connor, she explained that one possible testing method is referred to as lamp testing, which can be done by collecting an individual's saliva. This is a surveillance method that can detect asymptomatic cases. It's less invasive than a nose swab, and it can be conducted in different settings. Students could even use take-home kits to collect their saliva samples at home. However, there are difficulties associated with this method because this test is not actually diagnostic. And testing children can also get complicated for working parents for a variety of reasons. So, here's another alternative. The Binax Now nose swab tests are another option. In Dr. O'Connor's words, the ideal test is easy, inexpensive, and fast, and Binax Now fits that criteria. This method would be used for individuals in schools who have symptoms and their close contacts. This may mean that asymptomatic cases do go undetected, but with mask wearing and distancing, this testing could still be effective. The regulations involving testing can get a bit complicated, though Dr. O'Connor believes that schools can overcome this challenge.
Contact tracing is a method implemented to try and reduce the spread of COVID-19. We interviewed a contact tracer, Caleb Cohn, who directly contacts those who have tested positive for COVID-19. There are a few steps and procedures that take place when a contact tracer must contact a positive person. There is also a recommendation on what to do when contacted by a contact tracer. People who test positive are contacted as well as anyone they have been in contact with. Some questions that they are asked are the following. Where have you been during your infectious period? Where do you work? When did you last work? Who lives in your house? Who have you been in contact with? And are you able to fully separate in your house? The instructions then given to those who are contacted are recommended quarantine and isolation dates for any positive person in the household and any other people they have been in contact with. During earlier COVID stages, everyone regardless of test result was contacted. Because of spike in cases recently, only people who have tested positive are contacted. Public health nurses who have more authority than contact tracers contact workplaces if there is a known outbreak. Public health nurses also contact schools and prioritize information being passed to schools in order to make sure that kids who are exposed don't go to school. Does contact tracing work? Knowing all this information, we then asked Caleb Cohn to tell us whether or not contact tracing actually works. In certain counties, health officers technically have the authority to put police officers outside people's doors to ensure that people are following recommendations, but people technically don't have to listen to any contact tracers. When contacted, people often become upset because they feel their personal life is being intruded on. Though contact tracers' main priority is trying to stop spread in schools, these reasons can diminish the effectiveness of contact tracing. Though COVID has an infectious rate of 2, which means that at least 2 other people will be infected by the originally infected person. So even if not everyone listens, at least some people do, which greatly helps reduce the amount of people infected.
We thought it would be helpful to show you different graphs that provide COVID-19 information for cases in the area. This first graph shows the progression of cases in Dane County. Second, we have a map showing us where the COVID-19 cases are specifically located in different areas of Dane County and the city of Madison. We found this map in an article which has the following quote. As the saying goes, knowledge is power, and UW-Madison geography PhD student Atlas Go, wants to get that power in the hands of Madison area residents. I shared this quote because I think it helps to describe the basis of our project. Back to the map though, Atlas Go made this really valuable source of information for us. You can even personalize it by typing in a local address. This seems especially useful in allowing people to assess their level of risk based on where they work or live. Lastly, this is a snapshot of the UW-Madison COVID-19 case dashboard. A dashboard like this is very useful to have in schools. However, I think this model could be improved by incorporating elements from what we saw on the previous slide and providing a further breakdown. In schools, perhaps this could even include a breakdown of cases by class.
Now we'll talk about the importance of getting the vaccine. There has been a lot of talk about a vaccine, and hopefully soon we'll have one approved for public use. When thinking about possible side effects of the vaccine, it's important to realize that while vaccines are being developed as quickly as possible, routine processes and procedures remain in place to ensure safety for the public. It's also one of the quickest ways for society to get back to normal because then people wouldn't have to worry about carrying the virus and spreading it to others. In an article titled How Pandemics Change Us, What History Has Taught Us, and What It Means for Us Today, Richard Conniff states that the first time a vaccination was created for a worldwide pandemic was for smallpox on May 14, 1796. A doctor named Edward Jenner figured out that when he injected a less virulent cowpox, which was a similar disease, into a boy with smallpox, he was healed. Smallpox continued to kill many people, but after a global vaccination campaign, the World Health Organization declared smallpox was eradicated. This shows us how vaccines can help to end pandemics like this one. All of these reasons show the importance of getting the vaccine, especially for the younger generations who may carry it to the high risk. As teachers, you can share this information with your students to try and make them aware of this importance of getting the vaccine for themselves and society.
We wanted to provide a visual of what this information could all look like if we compiled it into the form of a website. We've even linked many of our slides to this page here, which you'll see at the top.
We researched a case study that was performed in an elementary school in Spain, who had very similar guidelines and precautions as those currently being enforced in the U.S. Dr. Randa Grab-Zachary explained, "It is not that closing schools leads to a decrease in cases or that opening schools leads to a surge in cases. So this leads us to believe that the opening of school districts is not the main cause of COVID outbreaks, or even a cause at all. With students wearing masks at all times and following social distancing guidelines, school is no different than, say, a grocery store." Additionally, Enric Alvarez found, for all of the students and staff who tested positive, 87% of them did not infect anyone else at the school. While few students overall seem to get COVID from the school, those who are infected usually don't spread it to others. Because of the advancements of contact tracing paired with mask wearing and social distancing, usually administrators are able to identify those with the virus early and isolate them, prohibiting the spread. While few case studies have been conducted in America on this subject, considering most schools have switched to virtual learning indefinitely, the Infectious Disease Society of America expressed that the data so far are not indicating that schools are a super spreader site, which is similar to the data that was collected in Spain. Overall, this case study concluded that the benefits of in-person learning, including physical activity, access to food, social situations, and increased social skills, along with, of course, education, outweigh the possible risk of contracting the virus. While it is still important to be cautious of this disease, we believe it would be very beneficial to the students to conduct in-person classes. This graph shows the relationship between daily COVID-19 cases and the number of daily cases. As you can see, the dotted line represents the day that schools reopen, and for the most part, the trends of these lines do not differ significantly from before the reopening of schools. Most countries with the downward trend continue to see a decrease in cases, which also supports the case study done in Spain. So, we urge you to take advantage of our presentation. It provides a wide variety of information that we have gathered here from the experts. This pandemic so clearly impacts teachers that remaining uneducated about the pandemic likely is not a viable option. Apply what you have learned to aid your response to this crisis. Let this information push you to advocate to an even greater extent in order to help keep yourself and your classroom safe. These are our resources with MLA citations.